going to start at the beginning and tell you what is not a pleasant story, but it's a story of research and discovery, and I believe a new beginning for brain injury survivors. Epilepsy, PTSD, nerve healing. Again, it was a long highway, and I'm going to start on 4th of July weekend, 1989. My family and I had gone to lunch, and my son and caregiver needed a diaper change before we went in. And I was going to let a napkin, walking back to the car, and a 16-year-old backed over me the wrong way against the arrows and changed life as my family and I knew it. I did start having seizures immediately after my brain trauma, but I didn't know it, nor was I told it from observations in the hospital, and they didn't manifest themselves in my conscious state. So after a year of rehab, I was actually able to go back to work for the Department of Corrections as a probation and parole officer. When I had that injury, I was also in my second year of law school. You know, one of those few times in your life when you think you really have the world by the tail. Well, not so much. The news is never good that you have a brain injury. But I only had 2 years to get used to that news before I had to get used to having uncontrolled epilepsy. And it was my supervisor at work that noticed my seizures, and epilepsy is a ban from law enforcement throughout the nation. I was not safe for myself or others any longer, and I knew that. So I gave up the career I had wanted since I was 8 years old. My diagnosing doctor was a stroke survivor, and it was a wealth of information, but he let me know right off the bat that it would be pointless for me to go back to law school as bad as my short-term memory was. He was very, very honest with me. And we made it. Those seizures started, and you know, it just didn't seem like any big deal. First medicine I took, well, I had a rash from it. I was told there were many. Second medicine I took, well, I had another rash, so he just couldn't believe that was possible and sent me to a dermatologist. Sure enough, it was a medicine rash. And then the third medicine, I really wanted to be seizure-free. So he said, if you have your tubes tied, you can take this medicine. So I did. And I couldn't take it either. So in 1992, I'd already tried every possible medicine, and by 95 was being evaluated for brain seizure surgery. I tried several more medicines after that, but to no avail. I was taking 400 milligrams of phenobarbital, 16 milligrams of Klonopin, antidepressants from day one, more medicine, more pills than I could keep track of. Somebody else had to keep track of it for me. The hardest part was knowing they didn't help. My hope was in future medicine. Back in the 90s, I started being told which medicines to look for. Some of them I was the first to try once they were FDA approved. And just nothing worked for me. In 1997, I got a chance to go to Hawaii from Birmingham and be evaluated for the vagal nerve stimulator when it was still only being used for Parkinson's. At that time, I had been a military wife, and When I was re-injured, I was found not to be a adequate family plan in case my husband were to be deployed. And my husband was given an honorable discharge, and we were sent 5,000 miles home. I also lost insurance and rehab, and that was a long road to come back. I do understand when I hear veterans talk about their care, because I understand it was just an easy budget cut. I was an expensive dependent. My records were sent in 1995 and 96 to UCLA twice. I was turned down both times. I wasn't a good candidate because I had more than one area of the brain that originated seizures, so I'm not sure that they have a way of being positive today, but back then they told me that there was no way they could be sure what area was evoking the most seizures, so they could operate on a part that didn't make a difference at all. That didn't sound like a real good risk. I had an awesome neurologist, Dr. Leo Meyer, in Hawaii, and he really wanted me to get help. And those doctors are magical, and they're once in a lifetime. But the second time, we knew there probably wasn't any help for me. I was told in 1996 that a frontal lobotomy would be all that would ever control my epilepsy. July 22nd of 1996, I hadn't slept in 10 days and 10 nights, and my neurologist was frantic, and I was being given different medicines to try to get me to sleep, and nothing worked. And on the 10th day, I took a medicine that I was told would knock an elephant out, and I slept 3 hours. And when I got up, I could tell I was disoriented, but I didn't at all realize I was in any risk. I got up from a computer chair and accelerated backwards and flipped over a love seat and landed on terrazzo over concrete military flooring. And my family was on the mainland on vacation. I'd just gotten out of the hospital, and I didn't feel stable enough to leave my neurologist. And I was unconscious for about 24 hours alone before I woke up and realized anything had happened. And all I remember noticing was I was freezing cold because I had a cup of coffee in that hand. I intended to warm up, I just never made it. Well, that fall, that cup I had in my hand was solid pewter, and it was full of coffee, and it hit me in the left temporal lobe when I flipped over the love seat and landed on the back of my head. And that did optic nerve damage, and I could not see. Well, I apparently couldn't remember to eat either. My family came home 2 weeks later, and I hadn't remembered to eat anything in that 2-week period of time. My autonomic responses had been affected. And my husband told the chaplain about my injury, and within 3 months we were given notice that we would be sent home. Well, that is not how I needed that story to go, but it is how the story went. We got back to Birmingham, and the epilepsy center there refused to accept any of my records from Hawaii. Well, I just wasn't starting over with tests again at that point. You can only have so many abnormal EEGs when it should be enough. So in '97, I got a phone call to go to Hawaii and be evaluated for the vagal nerve stimulator. And back then, a 30% decrease probably seemed worth it to me, to be honest with you. But I had no more family living in Hawaii, nobody to stay with, and a surgeon who was very wise and did not want to do the surgery on his first epilepsy patient and send her back to the mainland for aftercare. He wanted to do that himself, as he should have. So I waited and was reevaluated. I lost my colon in 2001. It froze open from the megadoses of medicines I had taken for 10 years. Now, I swelled up like I was 9 months pregnant, and I went to the ER numerous times, and nobody could figure out what it was. And my seizures were so out of control that there just weren't minutes anymore that I don't remember that seizures were a part of life. And luckily, somebody asked for a surgical consult. And when they went in, he said that the organ was frozen open, dead, with just mega doses of undigested medicine. And he didn't know how I hadn't died of blood poisoning. Well, I didn't really understand what that surgery meant. I just knew I had to have it. I've had chronic wasting disease since 2001. It's very difficult for me to absorb anything that I eat. I was still taking 40-something pills a day, and nothing was helping me. I've learned to walk and talk again 4 or 5 times, but I could never get any further than that. I could never get past learning how to speak before I would lose something else. And 5 years ago, I had waited 3 years for a headache clinic in Chicago. And you got to fail at everything to finally make it to Diamond. And when I went, they didn't take my insurance. It was a private hospital, apparently, that had gone unnoticed for the 3 years I had the appointment. And I was told that it would cost $700 a day out of pocket, and I'd have to stay at least 2 weeks. And I live on disability, and I still had a child at home. That just wasn't happening. And with tears streaming down my face, I just looked at her and I said, I can't do this. I can't do this, period. And I got on a train, and I was leaving Chicago, going to Southern Illinois, and see the trains. Everybody goes to Chicago, not the direction I was going. And it was nighttime, and it was very quiet, and I was alone. And my 2 youngest kids had told me that medical cannabis would help my post-traumatic headaches. Well, I was raising kids, and my career had been in law enforcement, and my dad was the supervising federal probation officer of Tampa, Florida, and my mother was a U.S. Marshal. No, it just didn't get much. Well, I listened to them, but I knew the timing was not right. I still had too many teenagers at my house all the time. It wasn't my turn yet. And when I tried and failed on the last thing they'd asked of me, the headache clinic, and I understand that everybody has a different belief system, but since this is my story, I'll just tell you how it happened to me. I was coming back on that train alone with no clue. Backed in a corner, tried everything they'd asked of me, 19 anti-epileptic drugs, brain surgery twice I would have done, the vagal nerve stimulator twice. I just wanted a chance. And there just didn't seem to be one. And then, out of the quietness of the train, it was as if God whispered, Debbie, That marijuana is man's law, not my law. If it'll help those headaches, why wouldn't you use it? And I thought about that the rest of the trip home. By then, my youngest was 23 years old. He came downstairs the next morning and said, "Are you ready to go to Chicago?" And I said, "No, I'm ready to take my life back." I said, "I would like to try cannabis." He said, "You're kidding." I was 56 years old, knew that my daughters and 7 of my grandchildren would never have a thing to do with me again. But I've been walking this brain injury journey almost 26 years, and I haven't had a whole lot of good news to report to you all. And then 5 years ago, I started a trial, and I want you to know I was averaging 4 grand mal seizures a week. That's 16 a month. And my first year on cannabis, I went from 4 seizures a week to 4 seizures that first year. Now, y'all, the vagal nerve stimulator and a pacemaker being replaced every 3 years, and the vagal nerves severed and electricity going to my brain every 5 minutes only offered me a 30% decrease. 1,000% improvement? No brain injury survivor ever heard about those kind of hope. I hadn't. And if you'd have mentioned it, I'd have called you a liar too. I wouldn't have believed you. That's when I realized we only believe each other. Now that's the truth. I know there's some medical professionals in here, but if you want to know who brain injury survivors listen to, they listen to each other, because we really believe we're the only ones that understand each other. We do respect everything you say, though. Don't get us wrong. I'm here today because I got the opportunity, living in Illinois, to go to Michigan and do a trial. I only got that opportunity because 20 years ago I started writing brain injury, epilepsy, and PTSD poems. And they were willing to do the trial if I would just write how it went. Well, I didn't know a thing. And Cody, my son, tried his best to prepare me for this meeting in Michigan for a week. And it didn't go as planned. None of it did. I sat basically in a motel room with a chart that I made up myself. I'd never tried an indica dominant strain. I knew very little, but I knew what I came to find out. And I was fortunate enough that the dispensary owner's husband made a tincture out of THC and CBD, a 50-50 ratio, and they gave me a real small 1-ounce bottle. Well, I'm all about the research. I never fell into where I needed to. I've always needed the research. So just because it helped me wasn't enough. I had a couple of friends at home with different kinds of pain I wanted to try, make sure it worked on them. And it did. So I just thought it was for pain. No. 2 weeks later, Cody said, "Mom, we got to move." And I said, "What are you talking about?" And he said, "That tincture, you haven't had a seizure in 2 weeks." I had not gone 3 days without a seizure in all those years. I didn't know. I'm going to be real honest with y'all. I had 2 years when I could say I was a brain injury survivor. I've just been trying my best to stay out of ERs pretty much ever since then. Today, once I did the trial in Michigan and we found out what we needed to know, we started making plans. Okay, it's time to move. I had written and met with my state legislature, and Illinois had voted no again. Unfortunately for me, my lungs had stopped working twice and my heart had shut down once that year. I'd run out of time, and we knew it. So I had to leave AMA from the hospital to get on a plane and get out here, and I had a high school friend who is out here because she's in liver failure, and medical cannabis is saving her life. And she was waiting to get me what I needed until we could find the specialized help that a complex case like mine needed. I've been here 2.5 years. My first 6 months, I was floundering, doing my best just to stay alive, as always. My grand mal seizures were still doing great, but my life-threatening status epilepticus, my partial complex status, they were off the charts. Nothing was any better. I was having some paralysis with the seizures. Many things were getting worse, not better. And I had been approached by many hemp companies, but I'd already found when I was in Illinois and Michigan, I needed THC for my grand mal seizures. I have 7 kinds of seizures. I knew I didn't just need one component of a plant. I knew I needed whole plant therapy. But I also needed somebody that knew how to administer it to me in a way that I could heal this many years after the fact. Tisha Seiler found me of Canacea. She had noticed some of my writing on brain injury, and she had noticed that I had a CTE group. I do have dementia that is suspected CTE. She specializes in pediatric epilepsy, and she contacted me and said she believed she could help me. One of y'all want to know how tired of hearing that I was after all those years? I really interrogated her to find out her intent, and I realized she really did want to help me. And that just kind of blew my mind, and I agreed to meet with her. And that was 2 years ago. When she met me, I was with 2 of my friends. One suspected CTE also, another brain injury survivor. I was by far the worst cognitively, mobility-wise. I'm the one that had uncontrolled epilepsy. Tish looked at me and said, I'm going to be honest. I have never helped anybody with cognition as low as yours. When I met my practitioner, I could no longer remember how I made a cup of coffee that I've been making my whole life. I had no idea what I put in it. Not once a day could I figure out that simple process. Now, as a seasoned brain injury survivor, of course I noticed when the dementia set in. That's when music no longer cues you to person, place, decade. Yeah, when that time goes, it's a difference. And you don't have a new head injury, it's a difference, and you know what it is. I also had no way of knowing when I first started noticing it that there could be any hope for it. When I met Tish, my cognition was at its worst. I would tell you, and I've written about it, I was disappearing. I knew it, and I could say that to my son, and he'd say, no, you're not. And I'd think, you know what, I really am trying to be honest with you, but I know you don't want to hear it, so I won't mention it again. But I could feel it. I'd already tried and failed at everything. I wasn't afraid of trying and failing. I was afraid of getting my hopes up. I was afraid of believing in something yet again. And then I realized, you know what? This may just be what I've needed all this time. Who knows? I had nothing to lose. I literally, when you're dying, you don't have a thing to lose. I'd been dying and had a living will since my son was 5 years old. He's 28. Nothing new. But wow, what if? Well, that whole hope thing is real important in surviving with a brain injury, and I just never, ever once thought that there couldn't be hope. I may not have always been sure I'd live to see it, but now I'm going to tell you what I've seen in the last 2 years. And this really is my true life story. So if it sounds like the Twilight Zone to you, believe me, it feels like it to me. I was endocannabinoid deficient, so I had to go initially for a couple of weeks on special medicine. But it didn't matter. Within a few days of just being able to get some neuroenhancer to my brain, within 72 hours, my son and daughter-in-law would say there was a difference in night and day. I was a little bit more hesitant. I probably would have said, I probably gave it 4 or 5 days before I could say, you guys, this is not your imagination. Something's helping. I accidentally ran out because I forgot to tell her I was getting low. I didn't really understand how it all worked yet. And I went off of it, and I was right back down to the not being able to do coffee again. So then I had proof. Back on it, there I was again. Well, if I have dementia and I have suspected CTE, and now 2 years later, not only can I remember how to make my coffee every time, but I'm learning history and science and geography and all of the subjects I've not had time to relearn, as I've been relearning how to walk and talk so much these last 26 years. Now, this is the exciting news. You all know it has helped my epilepsy. I'm seizure-free from 7 types of seizures today. Now, that does sound ludicrous when I say it even, but I am. I almost don't remember what it was like to only live that way in a bubble, because you can't go out, because you're not ever safe anywhere you go. I noticed about 6 months ago that a plate burned me. When I was injured in 1989, I lost total and complete feeling in both of my hands. I've had no small motor skill ability. If there was a penny on the floor and I tried 10 times, I'd never be able to pick that up. So today I just don't try. It's simple. I have cut the side of fingers off. I have burnt my hands a million times, but I couldn't feel. If it doesn't hurt, it doesn't hurt. So my hands became like tools, literally. Well, one thing we were never talked to about since I started this brain injury journey, and many of my friends, and that's healing. My hands burned because I had feeling in them after 25 and a half years of total and complete loss of feeling. I have a C3, C6 spinal injury, I had a broken neck 26 years ago. I fell down the stairs 6 years ago and re-injured that neck and had to go in a back and neck brace because I'm not eligible for surgery, and was told I would be in it the rest of my life to be able to hold my head up. I just came out of that back and neck brace in December. I'm out of diapers today. I'm out of a seizure helmet today. I've retired 2 seizure alert dogs over the last 18 years. And today, I stand before you and say, I don't know what the sky is, because I haven't reached it. I know nobody expected me to get feeling back. I know I didn't expect to feel emotion and be able to cry like normal people, but that sounds like serotonin and dopamine, and I don't think my brain has known what those things were in a long time. And I'll just be honest with you, my diagnosing doctor was a stroke survivor, and he looked at me and he said, Debbie, if I had a room full of people and I told every one of them they were going to have a health disorder, he said, let me guarantee you one thing. When it came to brain injury, not a person would raise their hand. Well, a lot of my friends are spinal injury survivors as well. We all agree. The brain is our body's computer. It is the most important organ of this body. If, in fact, the most dreaded adult diseases are dementia and Alzheimer's, and everybody in this room knows that it is, and I sit before you with all this brain trauma and then finally getting dementia and CTE, and I'm doing better and better, well, whatever it is I've got, there's a lot of people who probably want to know about it. But as a brain injury survivor, I'll tell you the one thing I never had until I started on this journey 5 years ago. I went off of my antidepressants. They didn't work real well on me, and I didn't like not ever feeling emotion. That is isolating in itself. I feel overall well-being and inner peace that no amount of money can buy. It just can't be bought. This injury is not easy for anybody, but if it can be made easier, then my Lord, please do whatever you can to make it easier. My neurologist told me point blank, 30% of every epileptic that any neurologist has is just like me and can't be treated by anything conventional. There needs to be an option for us too. Thank God there was one. And I'm here to tell you, it doesn't just help me, it's going to help many. I'd already been in many medical journals as the worst case. Man, if you help the worst, just imagine what you can do with everybody else in between. Now, I, of course, don't have the worst story by any means. I'm the most blessed woman in the world to be able to sit before you all today. It was exactly 19 years ago that I got to do this in Hawaii after my severe injury, and I don't remember a word I said. I just knew that this was huge, that I got to come out here and really do this one more time and bring you good news for a change. And y'all, this is the most exciting news. Brain injury survivors, epileptics, people with PTSD, anybody with neurology disorders, that's where I'm going to go because that is my specialty of education. this is a brand new frontier with hope we never dreamed was possible. I would have never kept this word in. I really don't care what anybody in this room thinks of me. I really believe I tried to do everything I was asked to do, and it didn't work. And I'm so thankful that when I was in law school, the librarian took me under her wing and taught me how to research, and I was able to find the research as a patient and try it, and then be able to bring it to you all and say, it works. It is worth it. Go for it. And if I can say that to you as a 61-year-old grandmother of going on 13, with pride, and be a refugee family and proud to start over, because if it weren't for medical cannabis, I would not still be alive, and I wouldn't be here to tell you this story today. And I appreciate you for letting me come talk to you. Have I forgotten anything? Oh, okay. I was one of these brain injury survivors that when I got epilepsy, I really just didn't want to quit driving. You know, none of us want to give up that. And so I went to this psychiatrist and I said, could you give me a diagnosis of psychosomatic seizures? And he said, well, sure, if you get me your medical records. And I said, well, okay, that could take a while. He said, no, I mean all of them. I said, okay. Well, thank heavens, he asked me for that. I'd not been able to get any help. I had atypical seizures. And I got all my medical records and I took them to him. He said, leave them with me a couple of weeks. I said, okay. And he called me and my husband to come back and see him. And I went back. And he said, Debbie, anybody who tells you you don't have epilepsy just does not want to treat you. You definitely have epilepsy. And I'm sure the look of disappointment showed on my face. And he said, and number 2, no psychiatric patient comes and asks for the diagnosis, Debbie. He said, so what we're going to do is we're going to find you a neurologist. And that's when he found Dr. Leo Meyer in Hawaii. Well, the reason that's important is he was a stroke researcher and he's written many books. And he just took a real interest in my case because by the time I met him, I was really sick of doctors. I was really sick of being told things were going to help and they didn't. And I really did not want it to be epilepsy, and I'd been told it was. So I sat down with him, and I'm sure he remembers it well too. I looked at him and I said, I just have one question. And he said, okay, shoot. I said, I just want to know one thing. Are you an asshole? He died laughing, and he said, wow. He said, now you've not had really good doctors, have you? And he said, well, Debbie, I'm going to tell you something. He said, my wife, she may say on occasion I am. But the truth is, I can't say that any of my patients have ever said that about me. And I said, sir, I don't care what your wife thinks. I only care what your patients think. You will do. And I was the first patient that he ever saw have a seizure in person as a neurologist. And he asked me to write something. He suspected I had several seizure types. Well, I said, okay. And what he ended up giving me was a gift that I was able to share with millions around the world. He asked me to write about a seizure. I did. That first thing I wrote for him ended up on the Harvard neurology page that next year. And I didn't send it to him, but somebody did. So I want to leave you all with a couple of things. The first one is, many of you have no idea what it feels like to experience a seizure. And I think this gives you a glimpse. It's called It Is Nothing. It is the first poem I wrote. And when he read it, he had an intern that he had asked if she could sit in, and I gave her a copy to read. She had tears streaming down her face, and he had tears in his eyes. And he asked me at that point if I would continue writing. And I said, why? And he said, because other people need to hear what you have to say. And it's called It Is Nothing. I am pouring my coffee. I feel my face tingling. It will be all right. It is nothing. I see my coffee cup. I must concentrate. I don't seem to be able to pour this cup. Of course I can. Concentrate, concentrate. All right, look at the cup. Slowly, slowly. Good girl, you did it. It will be all right. It is nothing. I hear, but everyone is talking from a distance. Concentrate, concentrate. Good girl, you did it. I hear you, I just can't quite understand. Say it again. I'll get it this time. I am confused. What was I saying? What did you say? Concentrate, concentrate. Oh no. I feel like I'm dropping in the well. I don't want to go in the well. The well is so far away from you. Everyone sounds so far away. I'm trying so hard to stay. It will be all right. It is nothing. I'm sorry. I can't hold on. I must leave for a few minutes, but I'll come back. Just hold on. Don't be frightened. Don't be sad. I will be all right. It is nothing. Please don't treat me differently. I really am like you. I just go in the well sometimes. I'm all right. I will concentrate. Next time it will be different. Next time I won't have to leave. I must concentrate. It will be all right. It is nothing. And today, it really is all right.